Welcome to our instructional video showing you how to perform male muscular etching. Abdominal etching was introduced in 1993 and has been used to enhance the muscular architecture of men seeking improvement in their torso. Dr. Henry Mintz pioneered this technique. He also uses pectoral etching in the chest to define the pectoralis muscle. These techniques have improved through the years, especially since the scars are less visible and the results have improved. First, the surgeon evaluates the patient, his overall health, his goals, and his general physique.
When I go to the gym, I do see results. I see results like on my arms get bigger, my chest, everywhere else but my abs. My abs, I just could never get them the way I want them. My wife, she doesn't complain, but sometimes she does say her little remarks when we watch a show, like a movie where there's Hercules looking guys, and she's like, man, it would be so awesome if you could get your six-pack going. And
I've seen your pictures on the beach. You look great. You have, you're nicely fit. Your arms are big, your legs are big, your shoulders are broad, and there's just that little veil of fat that covers those abs. And I think that we can improve that, unveil those abs, get them a show, get them a shine, that six-pack come through. I think it'll do wonderfully. You know, the recovery should last, a week or so of work, and then probably get you back in the gym in 3 weeks. I bet over 3 months or so you'll get nicely cut. You'll get that six-pack back, and you'll be feeling good back to the beach.
And Chris is excited about what his wife will think.
I would love to see a big old smile on her whenever she sees me with my shirt off.
Abdominal etching patients should be relatively lean, with body fat up to 15 or 20%. They should have excellent health habits and long-term goals. Fat pad thickness and pinch test are necessary to define the appropriate procedure. Poor skin elasticity, sun damage, stretch marks, and substantial weight loss will limit the results. Modified etching patients are generally softer and have body fat percentages above 20% with less ambitious health habits. Chest softness and gynecomastia is present in about half of abdominal etch patients, and pectoral etching and gynecomastia excision can be offered. Puncture gynecomastia excision is preferred unless there are any suspicious breast nodules, which should be removed en bloc and sent for pathology. So after preoperative evaluation and counseling, patients are prepared for surgery. Just before surgery, we mark patient's anatomy for the procedure. We begin with the patient standing since the skin and fat shift when lying down. The surgeon marks the linea alba and lateral edge of the rectus muscles.
While he's flexed, flex for me again, we mark the edges of the inscriptions.
Modified etching patients do not require these marks. The inscriptions should be precisely marked. There are 6 above the umbilicus and none below. On the chest, the inferior and lateral pectoral edge is marked, along with the axillary fullness and any glandular fullness. Incision marks can be adjusted depending on patient preferences.
There'll be 3 incisions on the abs, 1, 2, and 3, and we'll use the areolar incisions for the top inscriptions as well.
There will also be an incision at the buttock crease. After general anesthesia, incremental pressure garments are used on the lower legs and air warmers can be used above. A Foley is not used unless the procedures total more than 3 hours of surgery. A single dose of low molecular weight heparin is generally used as a precaution for deep vein thrombosis. Once the drapes are in place, we can begin the Hunstad formula Tumescent Infiltration. All of the infiltration is done at the beginning of the operation to allow for vasoconstriction. All incisions are used for the infiltration. In order to perform etching, a more aggressive cannula can be used. The open basket is better for inline etching, and since the holes are in one place, it can be used to etch transversely. Also, utilizing a power-assisted device adds advantage for patients who are fibrous and makes the etching portion of the operation much easier. Dr. Mintz does not recommend more aggressive devices like ultrasound or laser because of the close proximity to the skin surface and the risk of blister and necrosis. Begin first with thinning the abdominal fat pad. Utilizing all 3 of the lower incisions, a fan pattern with cross tunneling is the best technique for smoothness. Usually a goal of 1 centimeter pinch thickness is appropriate. The lower abdomen should be slightly thinner than the upper so that it flattens the abdomen. Next, thin the fat pad over the obliques to about half of that thickness. As you thin this area, you will notice the junction of the thinner oblique pad next to the thicker rectus area. Next, we get to the etching. Etching of the linea alba can be done through the central incision. Linear pressure and pinch etching can be used to deepen the etch. The etched area should be about 2 centimeters in width. The linea semilunaris can be etched to enhance the transition through the lateral incisions and through the central one. It is easiest to begin the transverse etching with the lower inscription. Linear etching can be done from the same side as well as the opposite side. Doing this from both incisions enhances the results. In order to reduce the visible incisions, we can etch the middle inscription first from the opposite hip incision with linear etching using pressure etching. To enhance the middle inscription, the lower incisions can be used for etching with pressure and pinch etching. This is usually done in increments along the etched area. You can also reach the middle inscription from the upper areolar incision. The upper inscription is best reached from the opposing areolar incision. Using linear etching with pressure can enhance the etched area. Further thinning of the upper abs and upper linea alba may be performed through this upper incision. Let's look at the chest now. Generally, men complain about chest fullness and roundness, which gives them a more feminine look. The goal here is to create a more linear slab appearance that appears more muscular and defined. We can accomplish this with strategies of thinning and defining through etching and removal of any remnant gynecomastia. After tumescent infiltration, the chest fat pad is thinned similar to the abdomen, leaving about 1 centimeter of thickness over the pectoralis major and thinning the perimeter, especially laterally and inferiorly to about half that. The inferior edge of the pectoralis is etched most easily from the opposite areolar incision. Again, the corner of the pect major is most important in defining a more linear appearance. If the uppermost transverse inscription is high, sometimes a broad etch helps to define both. Then, etching is performed laterally from the axilla to outline the lateral edge of the pectoral muscles using linear etching with pressure or pinching. Take special care to define the outside corner. This really helps to reduce a rounded inframammary crease. Lastly, if there is any glandular remnant, it can be addressed with puncture excision. Perform blunt dissection below and above the gland to separate the areolar skin from the glandular tissue. Next, remove the glandular tissue in a piecemeal fashion with a hemostat and scissor. There will usually be more tissue laterally. Finally, after all of the abdominal and pectoral suctioning is completed, the patient is turned. Liposuction of the love handles is performed by cross-tunneling from the posterior and hip incisions. Dr. Mintz prefers incisions left open since it allows for excess fluids to drain. Suturing increases seroma formation, bruising, and stitch marks. After the suction is complete, the skin is washed and dried. Dr. Mintz likes to use adhesive foam tape for the etched area in order to speed resolution of swelling and earlier definition of etched areas. Elastic garments are necessary to reduce swelling and bruising. Post-op garments include waist binders and chest garments. Garments with sleeves are preferred if axillary suctioning is performed. Patients are treated outpatient for liposuction aspirates less than 5 liters, and low molecular weight heparin is given prior to discharge to reduce DVT. Dr. Mintz etched this patient 12 years ago. Ben has kept his athletic contours, again with great definition of his rectus muscles, nice linea alba, semilunaris, and transverse inscriptions.
And you can see, even after 12 years, it's very thin over the inscription, thicker over the rectus muscle, again thin over the inscription, thicker over the rectus muscle, and thin again. So the ab etching has continues to augment his muscles and give him a more healthy and athletic appearance. Tell me what kind of things you've done to stay fit.
A regular workout regime. I do weights probably 3 to 4 times a week, and cardio 2 to 3 times a week. I still watch my diet. I mean, I know that the abdominal etching has given me something that I couldn't achieve through, working out and dieting, but I do want to maintain it. So I feel that this, in conjunction with a good program, will help me continue to maintain this look.
Armand, tell me why you decided to do the ab etch.
I've always been an athletic individual and tried playing a lot of tennis, squash, a little bit of weights here and there, but not much. But I never could achieve definition, and this really allowed me to achieve this nice musculature definition that I always wanted.
And the ladies love it too.
Yes, they do. Meet one of Dr. Mintz's partners, plastic surgeon Herman Newell. It's been 7 years since his ab etch, and this doc is looking hotter than ever.
He's got nice ab definition, linea alba, semilunaris, and transverse inscriptions.
Ab and pec etching is relatively easy to learn, and results can last for an extended period of time. You must carefully assess the patient's goals and medical history. Planning and critical placement of marks are crucial when performing the surgery. The liposuction is tedious and detailed, but the results can improve a patient's contours and allow for a more athletic and pleasing physique. Thank you for watching Dr. Mintz's instructional video on male muscular etching. This has been a Hunt Magnet Media production.